Steps to Health is an exercise programme that supports and helps people with medical conditions. Medical conditions such as obesity, neuro, Parkinson's, dementia, mental health. It's done by the referrals through the local hospitals and doctors. If they have a patient that comes through and they feel exercise will support and help their condition, they will then refer them to us. We will receive that referral and we will then make contact with the patient and bring them in for a consultation and then take them through a programme. What they can expect is better well-being, perhaps be more active, and as I said, will support and help their medical condition. So for example, we've had people that have come in wheelchairs, we've had some people that have never used the facilities before but are now very active. Also being able to perhaps move more, walk more, but also on the social side as well. Perhaps come and speak to somebody that's actually gone through the Steps to Health programme and they can explain to you how great it's been, how wonderful they feel by coming through the programme. And sometimes we actually give them a trial period, so we will allow them to come in, give them a go and see how they feel after the first few weeks on a one-to-one basis with our GP referral instructor.
In terms of the partnerships that support the programme, the ones that we've been directly involved in over the last 18 months, 2 years, have focused around getting people with mild dementia or mild cognitive impairment more active. We've worked with Oxley's, we've worked with Mind, we've worked with we've worked with ukactive, we've worked with our NHS public health team. One of the things that we want to do is actually increase the understanding out in the community. And it's the strength of these partnerships and the enthusiasm of the people at the Steps to Health team that help deliver successful outcomes.
Wellness is a social enterprise that aims to improve older adults' quality of life. In this context, within this partnership, it's been really focusing on older adults' physical well-being and bringing them together, but also in their social well-being as well. We work with about 1,500 different care homes across the UK. We're looking to work more in the community, as we know that there's a huge need within the community as well to work with older adults, not just while they're in care. Social isolation, things like that, are a real problem, I think, within the community. And what we're working together with different community groups, and especially within leisure centres like we are here today, that's where we really see a need to actually bring people together out of their communities, out of their homes, and actually into a location where they can enjoy themselves, they can have fun, but more importantly, they're exercising and they're being fit and healthy.
Working with the Steps to Health programme has developed over the last couple of years. We started to run some exercise classes at Queen Mary's Hospital. We would have patients come in for 2 hours to take part in an hour of exercise and an hour of education, and we would run that across 6 weeks. And at the end of those 6 weeks, we invited the Steps to Health team to come in to talk to our patients about what's available for them in the community. We started developing a lot of referrals into the Steps to Health programme. A lot of patients would really benefit from coming to see us and getting the exercise and getting mobile and moving. But then once we finished, they would stop and they didn't really have anything to follow on with. So the Steps to Health has been brilliant for that, for us, to feel as though actually they've started going, they've got moving, they're starting to see the benefits, and we can keep them going and hope that they will keep going for longer and not need to come back to us because they've been continuing on with this healthy kind of pattern of behaviour and the exercise.
I'd known about Steps to Health, and so I was very happy to accept the invitation to come and speak to residents. And what really struck me as I went around the tables was the amazing amount of unsolicited stories from people who said it had been a lifesaver, it had been a lifeline, the difference it had made to them was unbelievable. But for me, the unexpected bonus was the amount of people who had told me it had led to a really good social life and good friendships.
Living on my own, that's something to look forward to. People keep telling me I look so much healthier.
Mental health's got such a massive stigma around it, and people do cross the road because there's a stigma where people don't know how to attempt to bond with that sort of thing together. But with here, you'd come to the gym, and even if Adam wasn't here after he'd seen you on a session, you could then sort of literally go up to anyone and just go, I'm struggling with that. And it's anxious at first, but you get used to it, which makes you more confident which gets rid of your anxiety, which makes you feel like part of society. And so that, to me, is that people are giving me that time of day makes me feel very overwhelmed. It needs to be rolled out across the country, I think. Let's get it out there.
Actually coming to the gym, going swimming, it's really helped me, and it's taking less steroids now because I've only been for a few weeks. It really has helped me. Thank you.